please subscribe and don't forget to press the bell icon to get notified whenever we upload a new video.
Diabetes, one of the most prevalent and talked about diseases in the country, with India often being referred to as the diabetes capital of the world. Over 69 million Indians and counting suffering from type 2 diabetes, but the biggest problem remains the fact that awareness about this disease is still at very low levels in the country. And through this special series, Live Well with Diabetes, we hope to target just that and create more awareness amongst the scores of Indians. We've traveled through lengths and breadths of the country, talking to the most prolific experts about the impact of this disease on the human body. But in today's episode, we're not only going to talk about how diabetes affects the overall health of a person, but also specific organs, the heart as well as the kidney respectively. In the 6th episode of Live Well with Diabetes in Hyderabad, I'm joined by 3 prolific doctors from the city today.
On our panel today, we have with us Dr. K.D. Modi from Hyderabad. Dr. Modi is a leading endocrinologist and has been a consultant at many hospitals in Hyderabad. Next on our panel is Dr. Chandrasekhar Varada, a renowned cardiologist who has been practicing for over 19 years. Dr. Varada is a senior interventional cardiologist at Yashoda Hospital in Hyderabad. Our third panel on the show is leading nephrologist Dr. Chakravarti is the Director of Nephrology at Star Hospitals in Hyderabad.
Thank you so much for joining us on today's show. And if I can come to you first, Dr. Modi, we are talking about the overall health and how it will be impacted by diabetes. Talk to us about this disease really and how it affects the human body.
Actually, diabetes is perceived as a disease of carbohydrate metabolism. But in fact, it affects all the metabolism, carbohydrate, fat and protein metabolism. So it is called pan-metabolic disorder. And when lipotoxicity and glucotoxicity, when these two metabolism get disturbed, you get type 2 diabetes. And yes, it is characterized by high sugar. Blood glucose is high, fasting blood glucose, post-blood glucose. But it affects all the metabolism and it has a very high possibility of affecting small vessels and big vessels in long run and thereby affecting all the system including heart, kidney, retina, fit. So to begin with, diabetes is a very simple disease.
Sure.
But on long run, it is a very disastrous disease.
And for the viewers, if I could just get a few of the key symptoms of diabetes in the initial stages?
Actually, commonest symptom of diabetes is no symptom. Most of the patients are detected accidentally. You get your blood glucose checked and you find it high. So on routine examination, you find it high blood glucose. But otherwise, classical symptoms are like unexplained weight loss. You get a lot of urination.
Sure.
And you get thirst, increased thirst. You get burning feet. So these are classical symptoms. But I would say commonest symptom is no symptom. And that's why everybody should get his blood glucose checked at least once in a year after 40 years of age.
Sure. Dr. Varda, if we can work you into the conversation, we just heard Dr. Modi indicate that it affects organs across the body. So if I can specifically throw the spotlight on the heart, the organ that you specialize in, how does diabetes affect the heart, if at all, in the long run?
So diabetes causes something like a vasculopathy, which affects the blood vessels in the body and more so the blood vessels in the heart. And diabetes also comes with a milieu of metabolic disarray in the body, which is in the form of altered blood sugar, altered blood cholesterol, and altered mediators of inflammation inside the body.
Sure.
So all these together promote what is called atherosclerosis, or the clogging of the arteries that supply blood to the heart. So the consequence of this is what we call coronary artery disease. And diabetes is a very important and probably the single most important modifiable risk factor for heart disease.
Well, before I actually come to how to actually change your lifestyle, to ensure that the risk factors are at bare minimum? If I can work you into the conversation, Dr. Chakravarti, we heard how diabetes could impact the heart, but what really does it do to the kidneys?
The kidney is a little different organ compared to other regular organs. It gets almost 25% of the blood which is pumped out of the heart.
Correct.
That means it does a lot of metabolic activity for its function. And these units which actually filter the blood and make urine are called as glomeruli. They are actually small filters. So these have a lining known as the basement membrane. So diabetes, when uncontrolled, will change the character of these filters. And then it starts off over a period of time to damage the function of these filters, resulting in kidney failure, which happens over many years. So initially it is a simple change in the filter characteristics which leads to some amount of protein leakage. But over a period of time, the function drops to very less levels, needing support from outside, which we call it as dialysis also. So it is actually a blood vessel disease, but because of the design of the kidney, it presents in a different way and progresses to what we call as end stage kidney disease, wherein somebody needs support from outside.
Sure. Well, Dr. Modi, if I can come back to you, a lot of these symptoms and complications that arise out of diabetes are of uncontrolled diabetes. But one thing that is almost synonymous with diabetes is insulin. So if you can talk to us about how insulin is used to treat diabetes, and there's also a misconception or stigma, kind of fear when it comes to, adding insulin to actually keep your diabetes at bay. What are the common misconceptions out there?
Actually, 70% of type 2 diabetic patient, they stop responding to tablet after 6 to 7 years of having diabetes. So when you have diabetes duration of 6-7 years, your tablets may not work. 70% chances are there, and you will need insulin. Because tablet also, they work through pancreas, they stimulate pancreas, and pancreas will produce insulin. So many patients of diabetes, they require insulin. So when you need insulin and if you don't give, then there is no way you can control blood glucose. So people postpone it, people don't accept insulin, and they leave their sugar high. And because of that, ultimately they get complications like kidney problem, retina problem, blindness. Once they get complication, then only they accept insulin.
Sure.
So this is the misconception. They accept insulin very late. If they accept insulin early stage, then they can preserve their organ. So that's why trend is for early insulin therapy before your organ fail. So now we have ultra short acting and long acting insulin just to mimic normal physiology, and it will give a good blood sugar control.
So there is no need to actually fear insulin, and the sooner you actually start it.
Absolutely no. Only problem with insulin is orally you cannot take, because insulin is very delicate molecule in stomach. Because of acidic pH, it will get destroyed.
Sure.
So you need injections. That's the only problem. But otherwise, there is absolutely no fear. It is the most physiological medicine for diabetes.
Well, the most effective physiological medicine for diabetes is insulin, is the word coming in from Dr. K.D. Modi. But on that note, we'll slip into a quick break right here on Live Well with Diabetes. When we come back, what are the early signs of heart disease or kidney disease related to diabetes, and how do you ensure you can control that well in advance? Take a short break and be right back. And I'm taking the conversation now to Dr. Rajshekhar Varda. If I can ask you, sir, sometimes it doesn't get detected and it's a little too late. So when you talk about diabetes with heart disease, are there any warning signs or early symptoms that you can watch out for? And when you talk about the man and the woman, are there any gender specific symptoms or trends or differences that you can see when it comes to diabetes and heart disease?
Yeah, it's a very good question, because the unfortunate thing about diabetes and heart disease is that a significant proportion of diabetic patients have silent heart disease. Silent in the sense that they have heart disease, but they don't manifest any symptoms.
Sure.
So quite often they're first detected when they have a heart attack or when the heart has already been damaged. So when the patient has any symptom, of course, the patient has to be worked up extensively to look for any blockages in the arteries that supply blood to the heart and identify the disease very early so that early treatment can prevent progression of the blocks as well as prevent heart attacks in future. It is noted that women who are diabetic, when they develop heart disease, they probably have much worse disease than men.
All right.
For some unknown reason. And they also more likely to have extensive blockages and also what we call diffuse coronary artery disease, that the blockages are very diffuse and not focal. So they are more difficult to treat. They can be treated, but they are more challenging to treat. And also women are more likely to be misdiagnosed when they have heart-related symptoms.
Interesting.
So it is it's across the table that women are more likely to be they're more likely to overlook the symptoms themselves.
All right.
Or their symptoms are likely to be overlooked by their family or sometimes being overlooked by their physicians.
Physician as well.
So this could have a social root in its cause, but then it's a known fact across the world. It's not just in India, but all over the world, women are more missed when they have heart disease.
So no ignoring those warning signs, especially if you're a woman.
Especially.
Sure. Dr. Chakravarti, we did hear about, how it may not really have any warning symptoms as far as the heart is concerned. But any such early or late symptoms that we can look out for when it comes to the kidney, issues related with diabetes?
So the problem is the same, and for all organs, even kidney disease doesn't present with any symptoms early.
Particularly.
And the recommendation is every diabetic should have a routine screening of his kidney functions and a urinary test for protein presence in the urine at least once a year.
All right.
And those who have been detected to have anything like a protein in the urine will have it more often, like once in 3 months, and sometimes if 2-3 months tests are okay, once in 6 months. So screening early for every diabetic from the day that he is diagnosed is a must.
Well, if I can ask you, Dr. Modi, we did hear, how it affects specific organs. But when we come back to insulin, we just spoke about that in the earlier segment. What are the different options available out there, different kind of methods of insulin treatment? Because that is something not too many of us out here are aware of.
So ultra short acting insulin like Lispro, Aspart, Glulysin, all these are available and they control post-meal blood glucose in a very nice way. For elderly people, we have premix insulin, like those who find it difficult, is long acting, short acting. For them, premix insulins are there. So premix insulins are for convenience, they are good, but flexibility is less.
True.
Like if somebody requires a 40-50% of short acting insulin and 50% of long acting insulin, then it becomes difficult. So convenience purpose, premix insulins are good.
Sure.
But flexibility wise,
it's a little low.
low.
But it looks like there is custom-made treatment as far as insulin is concerned. The option for the patient is quite a few. Well, we did hear from both our specialists when it comes to the heart as well as the kidney. Routine checkups post-diabetes becomes mandatory for that early detection because symptoms are not going to actually present themselves. But if I can ask you, Dr. Varada, are there any lifestyle changes or any precautionary steps that a person suffering from diabetes can, apply or ensure to prevent any occurrence of heart disease? Is there a possibility?
So we should now evolve into a lifestyle which involves standing and working on a computer desk, standing and walking around while you are working or having a meeting, and no longer sitting in armchairs and
sitting for like 10 to 12 hours.
10 to 12 hours. And we think that it's enough if you work out for half an hour or 45 minutes in a day. So one has to be very active. So the human bodies are designed to be active and not to be sedentary. So unless we bring about a paradigm shift in our thinking about what is exercise and what is activity, and be extremely conscious of what we eat and keep our weight within what is our ideal body weight. So these three things are the most important things.
Absolutely. So be calm, eat better, and live an active lifestyle. Some of the tips that can actually help. I asked Dr. Varada what happens before. But if I can ask you, Dr. Chakravarti, what happens after? Now, should a person suffering from diabetes be contracted with kidney complications, how at the doctor's end do you then, make sure that the kidneys are functioning at best with artificial support even?
So one thing, apart from good sugar control in a patient, cutting down on the salt, which we already mentioned, cutting down on the fat intake overall, and then avoiding certain things which will damage the kidney. Simple thing in our country, especially across the counter medications. So all these medicines do get to kidney to come out of the body.
Correct.
So painkillers, antibiotics, unnecessary medicine usage is one thing that would actually damage the kidney along with the uncontrolled blood sugars.
Well,
So screening regularly for urine protein, and once you see the urine protein, there are drugs now available to reduce the protein loss.
absolutely.
When you do that, further deterioration of kidney function does not happen. So diabetes and kidney disease, they are eminently treatable in the sense, though you cannot make them normal, you can keep them under control and not allow further deterioration for several years.
Well, absolutely. Thank you so much for that, doctors. Because we're running short of time, I now come across to the three of you with quick 3 tips on how to live well with diabetes. And let me begin with you, Dr. Modi.
Get your sugar checked at least once in a year after 40 years of age. Once you have diabetes, have disciplined life, have moderation in food, and have your medicine regularly, and check your blood sugar regularly.
Absolutely. Dr. Varda, if I can ask you the same.
Eat well and live well, exercise well, take care of your medicines, and eat, love, and pray. There's a book by that.
Absolutely. Dr. Chakravarti, it's not life-threatening, so how does one learn to cope and live well with diabetes?
So the minute you are a diabetic, as my colleagues have told, you should eat well and also exercise well. And once there is a kidney disease detected, it is not the end of the road. A lot can be done today to postpone the eventuality of dialysis and transplant. But when they are needed, even they are life-saving, and people live very well with kidney disease not progressing, with dialysis and with kidney transplant doing extremely well.
Well, you heard it from our team of experts. Diabetes is a disease that you can learn to live well with as long as you make certain modifications to your lifestyle, to your diet, and of course, ensure that you take routine tests across the road once you're diagnosed with diabetes. And on that note, I'd like to thank each and every one of you for joining us. And from all of us who put the show together, thanks for watching.